Complications of diabetes. Diabetic coma. Blood sugar rise. Heart and blood vessel problems, stroke. Eye disease, retinopathy, kidney disease, nephropathy. If the information in the article varies from what your doctor tells, please follow the instructions of the doctor. Complications of diabetes short-term. Diabetic coma. Diabetes can result in life-threatening short-term complications. Diabetes patient may present with sudden loss of consciousness. This may follow an array of symptoms and situation. Loss of consciousness in diabetic could either be following too low blood sugar, thereby resulting in hypoglycemic coma, or too high blood sugar culminating into diabetic ketoacidosis. Both these conditions are emergencies and the patient must be taken for physicans care immediately. Hypoglycemic coma. Insulin injection and oral tablets are prescribed to reduce sugar in blood in a diabetic person. However, if sugar falls down rapidly, it is known as hypoglycemia. This may result in following symptoms. 1. Blurring of vision. 2. Excessive appetite or hunger. 3. Palpitations. 4. Shivering of body. 5. Excessive sweating. 6. Unsteadiness of limbs. 7. Unusual behavior, attitude. 8. Loss of consciousness, coma. All patients taking oral hypoglycemic agents or insulin must be aware of these features of this complication. One must take medicines in time, which must be followed by food. Why and how these symptoms are encountered. 1. If dosage of medicine, tablet, or insulin is higher than that required for food eaten. 2. If intake of food is insufficient. 3. The patient does not take food after medicine is taken. 4. If patient delays taking food long after taking insulin. 5. Excessive physical labor or exercise is done. What must be done if hypoglycemia is encountered? When above symptoms are encountered, the patient should immediately mix 4 to 6 teaspoonfuls of sugar into a glass of water and drink it. One may take a glass of fruit juice, couple of pieces of sweet biscuits, handful of sugar, or some sweet fruits. This should be followed by a meal. If the patient is comatose, she should be taken to a hospital. She requires intravenous 25% glucose immediately. Diabetic ketoacidosis. Diabetic coma. Patient dependent on insulin may encounter diabetic coma when a patient takes lower dose of insulin or forgets to take insulin in time, does not take insulin deliberately, or encounters physical stress like infection. Her blood sugar rises. Due to lack of insulin, sugar in blood cannot be utilized properly. The body tries to use its own stored fat, but due to improper assimilation of fat, some harmful chemicals named ketones form and accumulate in blood. Consequently, the patient becomes delirious and lapses into unconsciousness. Acetone also accumulates in the body and is passed in urine. This condition is called diabetic coma. Complications of diabetes short-term. Blood sugar rise. Why does blood sugar rise? Blood sugar rise due to any of the following factors. 1. If more food is taken than prescribed diet. 2. If physical labor or exercise is not done adequately. 3. If insulin is taken at a reduced dose or it is not taken at all. 4. If oral medication is not taken. 5. If there is attack by any infectious disease or virus, the patient is in severe physical or mental stress, and/or 6. Insulin treatment is discontinued due to other treatment. Symptoms of diabetic coma. Following are some signs and symptoms of diabetic coma. 1. Excessive and repeated urination. 2. Excessive appetite and thirst. 3. Sickness and fatigue. 4. Weakness. 5. Headache. 6. Blurred vision. 7. Drowsiness. 8. Nausea. 9. Rapid rate of breathing. 10. Collapse. 11. Smell of acetone in breath. 12. Unconsciousness. 13. Seizures. As soon as one or more of these symptoms are present, the patient should immediately be taken to a hospital and managed by a physician. This is a medical emergency. Complications of diabetes are long-term concerns. Heart and blood vessel problems, stroke. Severe complications may arise from uncontrolled diabetes over a period of time. Long-term complications that are encountered due to poor diabetes control are blindness, paralysis, heart disease, kidney failure, tuberculosis, loose motion, inflammation of gums, sexual dysfunction, severe infections, and skin disease. People with diabetes are living long and more productive lives than ever before. The longer someone lives with diabetes, greater the chance of developing long-term complications. High blood glucose level contributes to long-term diabetes complications because it damages both small and large blood vessels. Also, high blood glucose levels cause inside wall of blood vessels to thicken. Over a period of time, small vessels of kidneys and nerves, and large vessels of heart, head, arms, and legs can become so damaged that oxygen and other nutrients cannot reach the areas in need. A person with diabetes may be more likely to have a heart attack or stroke, impaired vision and blindness, retinopathy, decreased circulation, peripheral vascular disease, foot problems and amputations, nerve problems, neuropathy, kidney disease, frequent infections, sexual problems, including infertility and impotence. Ongoing preventive care and good blood glucose control will delay or prevent long-term complications. Heart and blood vessel problems, stroke. Diabetes greatly increases risk of development of changes in blood vessel. These changes may lead to heart attack, stroke, or may impair blood flow in the legs and feet. Signs that are indicative of stroke include loss of consciousness, feeling dizzy, sudden loss of sight, slurred speech, feeling numb or weak in arm or leg of one side of body. Following symptoms may be caused by serious heart problem, chest pain, or pressure, shortness of breath. Understanding diabetes and self-care guidelines. Swollen ankles, irregular heartbeat. If one has any of the above signs, one should immediately go to an emergency room. Pain or cramping in calves, thighs, or buttocks during walking that goes away with rest suggests bad blood flow in the legs. One should inform the doctor about the appearance of symptoms. They may require further investigation or treatment. To prevent and treat heart and blood vessel problems, one should control blood glucose. Caesar. Never start smoking. Control blood pressure. Check lipids annually. Cholesterol and triglyceride. High levels of these require treatment. Reduce weight. If overweight, exercise regularly. If one has heart or blood vessel problems, one needs special medical advice on physical activity. Strenuous exercise may be dangerous. Decrease intake of alcohol. Complications of diabetes are long-term concerns. Eye disease, retinopathy. Over time, uncontrolled diabetes can cause permanent damage to small vessels of eye, especially back and eye's retina. This damage is called retinopathy. In its early stages, retinopathy doesn't affect vision. As damage gets worse, blood vessels can leak and, if left untreated, can even truly cause blindness. New weak vessels form. Understanding diabetes and self-care guideline these weak vessels, and it can result in blindness. Retinopathy can be treated by using laser therapy and surgery to seal off leaking vessels and remove blood-blocking retina. To reduce chances of developing retinopathy, have annual eye examination done by eye physician. Report any change in vision. Hyperglycemia can cause blurred vision. This is usually temporary and will clear up in 4 to 6 weeks with better blood glucose control. Early treatment can prevent or delay vision loss. Keep blood pressure under control. Do not smoke. Check blood glucose regularly and keep it under control. Notify doctor and ophthalmologist for any change in your vision. Nerves affect all body functions. Diabetes can damage nerves by injuring the covering of nerves, causing a condition called neuropathy. Keeping blood glucose close normal prevents nerve damage. Regular physical exercise also helps to keep nerves healthy. Feet and legs. Feet and legs are the most common areas affected by neuropathy. Symptoms of nerve damage to feet and legs include numbness, burning, loss of hot-cold sensation, tingling, pain and cramps. Digestive and urinary tract damage of nerve to stomach, intestines or bladder kinks. Constipation, diarrhea, nausea, vomiting and inability to urinate properly. Blood pressure. Nerve damage can prevent blood pressure from rising as it should when one changes body positions. Sudden low blood pressure can cause dizziness. Sexual organs. When small blood vessel and nerve to sexual organ are damaged, man may experience impotence and women vaginal dryness and loss of sensation. Good long-term control of blood glucose can help prevent or reduce diabetes-related sexual problems. The health worker should test neuropathy once every year. There are ways to treat diabetes nerve damage. Some medicines are available, but it is most important to keep blood glucose under good control. Complications of diabetes are long-term concerns. Kidney disease, nephropathy. Kidneys filter waste products from body into urine which is excreted. Diabetes cause small vessels in the kidneys to thicken, resulting in kidney damage, nephropathy. Damaged kidney cannot filter body's wastes effectively, and these wastes begin to build up in body, causing illness. Eventually, damaged kidneys may fail, making it necessary to have dialysis and/or a kidney transplantation. Signs and symptoms of kidney problems: early morning swelling around eyes, swelling of legs, high blood pressure, protein in urine. Understanding diabetes and self-care guideline. Kidney damage can be effectively prevented by controlling blood glucose and blood pressure. If the health worker tells damage to kidney has occurred, one can still do quite a lot to preserve the remaining kidney by meticulously controlling blood glucose and blood pressure. Bladder or kidney infections should be treated well. If one has symptoms of urine bladder infection, cloudy urine, bloody urine, and frequent urination, pain and burning during urination, back pain, fever with chills, contact a health worker immediately. In the next session, we will discuss about other health issues in diabetes, principles of diabetes management, self-care in diabetes, planning diet. Available now at daras.pk all over Pakistan, Bangladesh, Nepal and Sri Lanka.